morning. Today is Saturday, March 27, 2021. Today is our scheduled yoga therapy class through Sattvic Space, and today's topic will be again another request. Request is yoga therapy for insomnia and sleep apnea. We have done a program before on insomnia and sleep apnea. We've done it for insomnia and sleep apnea, and I just looked at the date. That was in last year, around April of 2020. That was during pandemic time, and we thought that panic, fear and anxiety is causing that insomnia, and we can do a good session. Now we'll do this little practice, so you will see how to practice yourself for insomnia and sleep apnea. The root cause of insomnia, not able to sleep, is your mind. That when the mind is active, cannot sleep. So in our Western medical science, the mind is all related to your neurotransmitters. So if you see all the medications which we are using in Western medicine to fall asleep or even to be awake, like medication for narcolepsy, medication for sleep apnea, medication for daytime sleepiness. These are all the medication which does the modulation of our neurotransmitters. One increases the neurotransmitters like a Ambien sleeping pill, which is called GABA. Another your say to keep you daytime awake. In daytime awake, just 1 second. When you want to stay in the daytime awake, forgot that. One is Sunosi is one, Modafinil. But in yoga, mind is regarded as a content of your five senses, what you are receiving through your five senses. If you put all of them in a container, that's your mind. So the sleep will come when you're able to quiet down your five senses. This is the fifth limb of yoga practice out of 8 limbs. Social restraint, niyam, personal restraint, niyam, asana, alignment, both external, internal, pranayama, the voluntary regulated breathing, then called pratyahara. Pratyahara is control of your five senses. And as you see all the time, our five senses is that I see, I hear, I smell, taste and touch. And most powerful of all the five senses is your vision. So what do you use as a tool to fall asleep? Is an eye shield. You're in airlines, you're in a long overnight flight in airlines, they give you an eye shield. Or if you want to fall asleep in the middle of maybe there's a noise around you, you use an eye shield. I had an interesting experience. I was in one of the nice hotels in Europe. And I saw on the bed there is lying a package, and the package says sleep aids. I thought, sleep aids mean they'll put some medication and others. But what I find out, they put the sleep aids to tame your five senses. First they put an eye shield to cover your eyes. Then they put a little bit earplug to close your hearing. They use a little sweet to put in your mouth. Remember, sweet is a taming of your taste. Bitter, astringent, pungent, it activates your taste. But sweet is soothing. They put a soothing. For the smell, they put a little bit of essential oil. And for the touch, they use the bed, which is called your bed number. That means you can adjust the firmness of your bed. The firmness of your bed causes a touch. So they're able to tame your five senses, you will fall asleep. Why we talk about mind? Because suppose you saw a movie, or it's a scary movie. Also a movie which one of the movie scene is really touched you. You cannot fall asleep. Or you're listening to say music. And one line of the music touched you, and it is continuously ringing in your ear and you cannot fall asleep. So able to control your five senses, that will be our yoga practice. Next, in sleep, the physiological changes takes place is a relaxation of the muscles and reduction of the body core temperature. Our body core temperature goes down and all the muscles starts to relax. So if you do a relaxation of the larger group of muscles in our body, especially they're called the paraspinal muscle next to your spine, primarily the spinal twist, or the muscles involving the larger area, like I said, gluteus, backs, like your spinal twist, bakrasana, say half of the Lord of Fish pose called Ardha Matsyendrayanasana, or say upper part of the body, prayer pose to the back with a neck rotation, or you can do even a shoulder stand and a plow. These are all relaxation of the larger group of muscles. Another important concept of sleep is that a relaxation response and a parasympathetic activation. When you activate the parasympathetic tone, which is calm and digest, which counteracts your sympathetic tone, and you fall asleep. In a sleep apnea, as we know, there are two kinds, a central and a local. And a sleep apnea, the tongue falls back, especially when you're laying down or sleeping on your back. So we teach people with the sleep apnea how to teach like a yogi. Yogis sleep always on the side, primarily on the left side, and we'll show you how to do it. Sleep like a yogi, and then we practice called Ujjayi Pranayam. In a Ujjayi Pranayam, it stimulates the laryngeal branch of the vagus nerve. The vagus nerve gets activated, the signal goes to the brainstem, and the output comes to your hypoglossal nerve, which is supplying your tongue. So it pushes the tongue in front, and also it supplies the two muscles in the soft palate called palatoglossus and palatopharyngeus muscle, tightens up and it stops snoring. So remember one thing, snoring is the marker of your sleep apnea. A long time back, we used to sleep, we used to say, oh, see how good he or she sleeps. We sleep with the snoring. Today we know snoring is a marker of sleep apnea. Ujjayi Pranayam, neck relaxation, those are the primary therapy. Let's go ahead and start, or before start, let's look at what is the timing content of the sleep. People always ask me, I'm going to sleep 6 hours, 8 hours, 10 hours. I said, no, there is no actually timing for the sleep. Sleep is called quality, called a deep sleep. Sleep you need to recharge your body. You know, it's like a cell phone, you're charging it at night, so sleep, you're charging your body at night. But during the charging of your body, the sleep, there is a lot of physiological changes takes place, which causes the repair of your body and mind, and sleep essentially is an anti-aging. During the fourth stage of sleep, there is an increase in the growth hormone. There's a lot of physiological changes. So, just to give you a nutshell, when the sleep has two components. One is called REM, rapid eye movement, and one called non-REM, non-rapid eye movement. A rapid eye movement is the mind is still awake. It's around 25% of the sleep, and that's the time all the dream takes place. Non-REM sleep, called non-rapid eye movement sleep, has 4 stages: stage 1, stage 2, stage 3, stage 4. Stage 1 and 2 is about 50%, and stage 3 and 4 is another 50%. Stage 3 and 4 is the deep sleep, at which time all the repair takes place in our body and mind. So think about, if you're sleeping, say 6 hours, so 25% is your hour and a half will be your REM sleep, and 75%, 3.5 hours will be your, say, non-REM sleep. Out of which the half, 50%, so little less than 2 hours is your deep sleep. That's the time you need. So if you practice a relaxation response throughout the whole day, so most of the yogis needs about just around 2 hours of deep sleep. It's a state of our mind. Mind, the first is called awake. I'm awake. Then it's called your dream. We say you're dreaming, daydreaming, dream. Then comes your sleep. We call it a jagroto, awake. Dream is your shopno. Sleep is your shupto. Then after sleep comes a transcendental mind, which is called your turiya. Turiya is a state of mind which is comes after a deep sleep. So you will know in a turiya, like you can sometimes fall asleep. And you have so much of a deep sleep that when you wake up, you're totally disoriented. You don't even know where you are. You don't know what time it is. And it happens to all of us. So, the first most effective therapy for the false sleep is a 2 pranayama. It's called the Bhramri Pranayam, bumblebee, and they're called Murcha Pranayam. Murcha is almost unconscious, means you fall asleep, you become unconscious. So, but before that, let's do one thing. Let's start relaxing our body. So if you can sit down in the ground, it is good. But if you don't, you sit down in a chair, you can do all of them in the chair. If you're sitting here, it's called the easy pose, Sukhasan. Put the feet underneath your knees, cross your spine and mind quiets down. The hand gets relaxed. Always remember, you sleep. Who is the best sleeper? We always say you sleep like a baby. So baby sleeps because their mind is completely clear. They're totally relaxed and will show like a baby. So the baby fist is called your Bolo Mush Mudra. Take your thumb inside and close. That's the way relax your hand with your breathing. Breathe out first. Take a deep breath in, thumb inside and close. Breathe in, breathe out. I do it with my eyes closed. When you do the eyes closed, you get a relaxation, not faster. Wrist gets relaxed, extension, wrist gets tight with it. Flexion. Breathe in, breathe out. Breathe in, breathe out. You can rotate your wrist. Rotate your shoulder, put a hand in the shoulder, elbows together. Breathe in, slowly rotate your shoulder. Breathe in, breathe out. And also you can do opposite, breathe in, breathe out. It's a very nice practice. Balance your body, as I said, when you sit down. Always cross your feet, sit down. Do a set of Bhramri Pranayam. Remember, Bhramri is closing down your five senses, then you create a vibration, so which is the same frequency of your brain. Two frequency cancels, it's called harmonic resonance, and mind quiets down. So put your index finger in between eyebrows. There's three fingers. You can do a lot of mudras called Shanmukhi Mudra. 3 fingers to close your eyes, thumb to close your ear and close your mouth. Literally, you have shut down your 5 senses. Always breathe in and out through your nostril. Breathe out first. Take a deep breath in and breathe out through your nose with the sound of a bumblebee. Then into the pumping and cupping, it activates your parasympathetic tone. You rub your hands. When you feel the warmth in your hand, if you're wearing glasses, you remove your glasses, take the hands, put it over your eyes like a cup, let the eyes take all the heat from your hand, massage your forehead, massage your eyes, massage your face, massage your ear, behind the ear, in front of the ear, inside your external ear canal. This is called your auricular branch of the vagus nerve. By stimulating, you're doing a vagus nerve stimulation. Bring your hand, massage in front of your neck. There is called a carotid sinus. Carotid sinus massaging also activates parasympathetic tone. It quiets down cardiovascular, neurological system. Bhramri Pranayam. You can incorporate the Bhramri Pranayam with your asana practice, and we'll show it to you now next, that we'll be doing a relaxation in the upper part of the body, which is called a prayer pose to the back. Take your hands to the back and just turn it around as a prayer pose. And remember, as I always told you, you only practice what a body will allow you. Pain-free asana, effortless breathing, and in stages, impossible become possible. So here I am here, My hand is up in a prayer pose to the back, which I have shown it to you so many times in the past. I will do the 4 movements of the neck relaxation, and in exhalation I will be doing the sound of a bumblebee, and the longer exhalation helps in parasympathetic activation. So first breathe out, take a deep breath in, slowly drop your neck to the back. See, you extend your exhalation, and I do with my eyes closed. Then you go side to side, right side and left side, see? And my hand is there, see my hand started going high up more and more, because it creates a relaxation of all the muscles and ligaments. Breathe out first, take a deep breath in, look back without turning your shoulder to the left and the right. Breathe out first. Deep breath in. Rotate your neck, left to the back to the right, right to the back to the left. Drop your head down, breathe out first, deep breath in. By the time you do these practices, which I do every day, you feel a profound level of relaxation, feel like you're emancipated. It's a wonderful practice. You do the Mush Pranayam. Mush Pranayam, Musha means unconscious. 2 components, you do a chin lock, when you bring the chin down towards your chest, call it chin lock. Chin lock activates the carotid sinuses in both sides of your neck, which is a parasympathetic activation. Also, in a Mudras Dhanurudra, you breathe out first, take a deep breath in, and when you hold your breath, your lungs slowly and slowly starts to expand. When it comes to a certain point, then it cannot expand anymore because of the rib cage. Then in the outer side of the lung, there is a vagus nerve which activates, and for the healthcare providers or the physiologists, is called a herring-brewer reflex. Herring-brewer reflex stops your lung to expand anymore, which is also through a vagal activation. So Mudras Pranayam is a profound vagal activation which even put you to sleep. So do your mudras, Dhanurudra, touch your index finger and thumb, put it just over your knees. First, you will breathe out first. Then you take a deep breath in. Hold your breath. Keep your neck straight. Slowly drop your chin down, close to your chest. And you stay here as long as you can and keep counting. 1 and 2 and 3. These practices you can even do even before going to bed. I just have an interesting story. One of my friends here, he was calling his relative back in India, and he said, "Oh, this is our bedtime. I'm practicing this Mudras Pranayam or unconscious breathing before I go to bed." He said, "Wow, where did you learn it from?" He said, "I learned it from your friend." So it's very important. A supported asanas, any asanas which are supported and can hold for a longer time, it brings a relaxation. See, muscles, ligaments tightens up to put you in a pose. But if you can stay in the pose a little longer and longer, the muscle cannot stay contracted too long. Muscle will start to relax. Relaxation before is called a fasciculation. Before relaxation, muscle is a little twitching, which is called sthiti. Then you get a profound relaxation, which is called your visarjan. Say for relaxation, supported poses, it's a supported forward bend. Okay, in a supported forward bend, okay, let me show it to you. If you can see me, I'll look in the back. This is my bench to the back. So my feet are together. If you can see me, feet are together. My hand is on my thigh and slowly I'm supporting myself and I can come down. Depends on how far you can come down. If you have a height here, let's say a countertop height, you can put your head on a countertop. If you can come down a little farther, you can put your head on a tabletop. Here, I can come down up to the bench, and if you can see me, I'm putting my head on the bench, my hands on both sides, my eyes are closed, I'm doing the breathing out longer than breathing in. I'm in a profound level of relaxation. You might be able to practice this before you go to bed. See my head, this is a supported forward bend. You can feel the tightness of your body is slowly is melting away. The hand starts to go down more and more. It's a wonderful practice, wonderful phenomenon. So you can practice one supported downward facing dog. I don't think you have seen it before how to do it. Let me show it to you. You know that the standard, the Adhi Mudra, downward facing dog. You're putting your feet down. You're almost like. And then you can do a little bit of many a time. Strengthening asanas. You know, little strengthening asanas also helps you to fall asleep. Sorry. Downward facing dog, you can do push-ups. You can go down, do push-ups. You can do Ram Murti Dhan. Ram Murti Dhan means you go down, you'll come back in the same way. You go down, come back in the same way. When you do this, like a strenuous practices, puts you to sleep. As simple as it is. Okay, let me show you what a supported downward facing dog, how to do it. Suppose I have this, I'm going to do a downward facing dog. Look at how beautiful it is. I come down, put my head my eyes are closed. I'm breathing out longer than breathing in. So I'm totally effortless. I'm talking. I'm breathing. I'm singing. I can see my breathing. It's getting deeper and deeper. My rate of my breathing is coming down. I'm already started to fall asleep. Supported downward facing dog. Can't have any better relaxation. Relaxing the big muscles of the body. One of the big relaxation is a spinal twist, Bakrasana. You can do the Bakrasana, fit here. When you relax, you will see your feet are all touching. Separate your toes, breathe in, breathe out. Then will relax your toes, relax your feet, breathe in, breathe out. I have shown you all this, how to relax your upper part of the body, lower part of the body. Breathe in, slowly rotate your ankle. Relaxation of the ankle is the most important practice. Remember, hip joint, knee joint, go to the opposite side, they carry the body weight. They just literally transmits the body weight. But the whole body weight is supported in your ankle. Right foot comes next to left thigh. Right hand will go to the back. Left hand comes outside your right knee, hand is high up, slowly comes and touches your knee. Breathe out first, take a deep breath in and slowly turn your face to the right side. Keep breathing. Breathing out longer than breathing in. Remember, balancing. Balancing also is very important. Very important for your activation. Same holding, hugging, relaxing. Opposite side. Now my right hand go outside my left knee. Left hand goes to the back. Right hand touches my right knee. Breathe out first. Deep breath in. Slowly turn your body. So a lot of powerful relaxing asanas you can do. You can do, say, Vaisasana. This is called your buffalo pose. That's where the buffalo sits. Vaisasana. You can go from there. It's called a cow face, Sukhasan, which relaxes the upper part of the body, lower part of the body. Remember what we're talking about. Using the larger group of muscles. And even this thing you can practice before going to bed. And when you do that larger group of muscle relaxation, then you can get into called a Savasana, corpse pose. And I'll show it to you, Savasana, with the breathing and how powerful that tool is. Then you'll be practicing sleeping like a baby and sleeping like a yogi. And that will be the end of our practice. So here, right knee, right foot comes to the next to your left knee. Left arm goes outside your right knee. Right hand goes to the back. Left hand touches the knee, slowly to the ankle and to the foot. Again, same breathing. Breathing out first. Breathing out longer than breathing in. Turn your body to the right side. So you can have a lot of asanas, you have a lot of yoga teachers also. On this show, and you know that relaxation of the larger group of muscles. You can do a shoulder stand, you can do a plow, but the most powerful tool is remember, the breathing. A breathing, the first is the bumblebee breathing, the Bhramari Pranayam, then was your Murcha Pranayam, we call it unconscious pranayam. Then the one that powerful is a Bastrika Pranayam. And you will see and before going to sleep, you can practice a very rapid Bastrika Pranayama followed by your Savasana. So a beautiful, powerful technique. Try this. Try a very rapid Bastrika Pranayama. I've been doing it for a long time, so let me show it to you. Rapid Bastrika Pranayama followed by corpse pose, Savasana. My hand is again in Adhi Mudra, which is relaxing, and you start doing a very rapid Bastrika Pranayam. Go to Sukhasan. Take your feet, separate the feet up to the width of your mat. Put your body down. Be sure, keep your head down. And chin generally will be below your forehead. Don't do this. This is very sympathetic. It's a parasympathetic. Let's continue again. Hand on both sides, palm facing high up, and slowly start relaxing your body. Bring your attention to your breath. I'll show it to you a little later how to do a profound your Savasana and also your Nidra. Try one more time. Try to get up, turn on your left side and get up. Do another Bastrika Pranayama and also followed by your Savasana. Another pranayam is your left nostril breathing. The left nostril breathing is called Chandra Pranayam, or a moon energy of parasympathetic activation. Left hand is Adhi Mudra. You close your right nostril, breathe out through your left nostril, and do the breathing through your left nostril in and out. Continue as long your body will allow you do effortless breathing. When you feel little effort, then you start slowing down. Alternate nostril breathing, called Anulom Vilom Pranayam, is also a wonderful practice for your falling asleep. And the way to do it is a focus with a balancing both sides. Close your right nostril, breathe out through your left nostril, breathe in through your left nostril, drop your hand down, close your left nostril, breathe out through your right nostril. Breathe in through your right nostril, close your right nostril and breathe out through your left nostril. Slowly bring your index finger and middle finger in your third eye. Use your left hand to hold your right ear low. This is a super brain yoga. And continuing your alternate nostril breathing with your eyes closed and mind focused at your third eye. Now let's practice another set of very rapid Bastrika Pranayama followed by Sukhasan, and when the Sukhasan is extended a little longer with a deep relaxation technique, it is your part of your Yoga Nidra, which is basically yogic sleep. Then I'll show you how to sleep like a baby and how to sleep like a yogi. And when you practice that during sleep, it may not happen on the first day, may not happen on the second day, but it will definitely happen. And I can tell you, I do it every single day. And every single day, I sleep like that. There's some room here. Okay. A rapid Bastrika Pranayama you can also do with your hand raised. Okay. This is our health tracker, Apple Watch. Very important to see. Rapid Bastrika Pranayama. Followed by Savasana and Yoga Nidra. So I have my health tracker again, and the reason for putting the health tracker is you will be able to see that you're having changes in your heart rate, changes in your blood pressure, changes in your EKG. Separate your feet up to the width of the mat. Put your head down. Try to bring the chin close to your chest. It's a Jalandhar Bandha, a chin lock, which is also very powerful relaxation. Hands on both sides, not too far, about 6 inches from your body, palm facing high up. You are receiving. Slowly and slowly shift your breathing to your abdominal breathing. Abdominal breathing is relaxing. Abdominal breathing is parasympathetic. In abdominal breathing, the abdomen rises with inhalation and abdomen goes down with exhalation. You will see a baby. When the baby sleeps, baby will have abdominal breathing. When the baby sleeps, you will see baby's abdomen will go high up, abdomen will come down. Now consciously with your eyes closed, with the effortless abdominal breathing, you start relaxing your body part at a time. Start relaxing your toes. Relax your feet. Keep doing your effortless breathing with your eyes closed. Relax your leg muscles. Relax your thigh muscles. Relax your gluteal muscles. Large group of muscles. Relax your abdominal wall. When you relax your abdominal wall, you can do a abdominal lock called Ujjayi Pranayama. You can do Agni. Relax your chest muscles. Relax your neck muscles. Facial muscles. The facial muscles that attach to the skin. When you relax the facial muscles, the lines in your face, lines in your forehead slowly and slowly goes away. You look more and more relaxed, more and more fresh, and look like you are glowing. Relax your shoulders, relax your arms, relax your forearms, relax your fingers. You will see one thing: when your fingers are not properly relaxed, your hands will be like a little high up. When the fingers are relaxed, slowly and slowly your whole hand will go down into the floor. Don't force yourself. This will happen on its own. Slowly bring the fifth limb, control of your senses. Your eyes are closed. You have a control of your hearing. Your smell and tastes are a little tamed. And your touch is very well controlled with this Sukhasan. Enter into the sixth limb. Focus with your eyes closed. Visualize a flame of a candle in front of your eyes, and keep your gaze in that flame of the candle. Slowly and slowly the focus will get defocused and will enter into meditation, the seventh limb. Meditation is yoga. Meditation is the seventh limb of yoga. Then you slowly enter into your eighth limb, Samadhi, union of your body, mind and spirit. When you get up from Savasana, you first start moving your toes, moving your hands, moving your lower part of the body, relax your body. And generally what you do is slowly turn on your one side, preferably on your left side. Put your head on a folded hand and bring the feet in like a fetal position. And after a while, when you are properly, you're balanced, then you extend your one leg and slowly get up and sit down in your cross-legged position. Now let's go ahead and start sleeping. When you sleep, remember, a sleep has a lag time. People say, I'm going to bed and I'm going to fall into sleep right away. When you fall asleep right away, you are sleep deprived. There's a lag time. It takes about roughly around 10 minutes or over before you can fall asleep. If you cannot sleep after about 30 minutes, then you develop your what is called your insomnia. So remember that sleep lag to sleep. And then before going to sleep, we do our ritual. Remember, sleep is a hygiene. You try to get into sleep every day on time, 10 to 4 in the morning or 5 in the morning, not past 6. Between 4 to 6 is a time to wake up. When you have a good night's sleep, you wake up without an alarm. You don't need an alarm to wake up. For people with a sleep apnea, we teach them not to sleep on their back and also practice a Ujjayi Pranayam. Ujjayi Pranayam with a abdominal lock, chin lock with a left nostril breathing. You have no idea what is going to do to you to fall into sleep. Okay, I'm showing you in stages, and then before you go to bed and what you do before going to bed. So let's show you a technique for people with a sleep apnea. Sleep apnea people say, how does sleep apnea? Sleep apnea people will have a daytime sleepiness. When you have a daytime sleepiness, you know you have a sleep apnea. Hand is in Adhi Mudra. You breathe out first. Take a deep breath in. Completely breathe out. Do it 3-4 times, you will see the effect of it in your body and mind. Closing your larynx, try to breathe in. It's called a resistive inhalation. Stimulates the superior and inferior laryngeal nerve, which in turn activates vagus nerve. Signal comes back with the hypoglossal nerve, pushes the tongue in front, and through-glossopharyngeal nerve tightens up your soft palate. Chin lock activates your carotid sinuses. Left nostril breathing activates your parasympathetic tone. Before going to bed at night, generally we floss our teeth, brush our teeth, then drink a glass of water. Very important. Hydration keeps you to sleep. People ask me all the time, when I have a prostate problem, I wake up in the middle of the night, I drink enough water, I'll be waking up more. Drink enough water of which you don't wake up. And also remember, at certain phase in our life, you wake up once or twice at night to go to the bathroom because of your prostate and because of your bladder irritation, entirely normal. Normally, when you get up in between sleep, generally it's about 20 minutes of lag time. You can go to the bathroom, you can have your time, come back, sleep, and you'll fall asleep in 20 minutes. Body will never know that you woke up and you took a break for 20 minutes. So don't get surprised, don't get very unusual. If you have a sleep tracker, you will see the sleep tracker will never record the 20 minutes you were awake. After drinking a glass of water, we do a called oleation of our nostril. Oleation of the nostril is very important for sleep because during sleep, the mucosa in your nostril gets dried up and your nose gets blocked. You start doing your mouth breathing, and the mouth breathing is the initiator of your sleep apnea. Always remember, we sleep through our nose. Insomnia is through our mouth. When you do the little oleation of the nostril, that mucus in the nostril cannot get dried up. So it remains open. In fact, in one of the language in India, which is called Bengali, there is a very common term called nake tel diye ghumai. Nake means nose, tel means oil. You put an oil in the nostril and you sleep. Generally, what I do, I use my little finger. It is my private practice. I dip it into oil and I put inside the nostril. I just massage it on both sides before going to sleep. So when you first sleep, you sleep like a baby. Have you ever seen how the baby sleeps? Baby will sleep. It's called Baddha Konasana. I'm getting two pillows for you to show it to you what the changes will take place if you give a little support. Baby always sleeps with you. I don't know if you have seen a baby sleeping. Observation. Baby will sleep with call your Supta Baddha Konasana. They will take both the feet, they put both the feet together and they will drop their knees down like this. This is the way baby sleeps. Now, let me show you, if you cannot put your knees down, you can take a little pillow. Put a pillow, take another one on the other side, and if you need another pillow, you can put another pillow under your head. An adult, you cannot do it, but the babies will sleep like this. This is called Supta Baddha Konasana. Babies will use their hand like a baby fist. It's called a thumb inside, and close your hand. They will drop the baby fist down. And now, for your adult person, when you are doing, first you bring your abdominal breathing. Breathe like a baby. Breathe in, abdominal wall will go high up. Breathe out. This is the way I start sleeping every night at the beginning of my sleep. Then we use breath holding. Breath holding is called CO2 narcosis, carbon dioxide narcosis. That means breath holding acts like a narcotic. So the way we do it, I will breathe out first, take a deep breath in, I will hold as long as I can and I'll practice about at least 5 to 10 times. Let me show you 1 or 2 times to show you how to do it, then you will be able to do it at home. So breathing out first, taking a deep breath in. Hold my breath. One round of breath holding. Let's show you one more time. We generally do it between 5 to 10 times. Breathe out first. Take a deep breath in. And hold your breath. Within a short time, you will feel like you are in a deep sleep. Then you practice what is called a Savitri Pranayam. In Savitri Pranayam, take a deep breath in, then you hold your breath. Breathing in is called a Puraka, inhalation. Breath holding in inhalation is called retention, called Abhantarin Kumbhak. Breathe out is called exhalation, or is called Rechak. Then you hold your breath after breathing out, which is called your suspension or Bajja Kumbhak. I also practice that few times, between 5 to 10 times. And remember, this doesn't take much time because you still have about lag time between 10 to 30 minutes before going to bed, before going to sleep when you are in the bed. So I'll breathe in with a count of 4 in. I will hold my breath for a count of 16. I will breathe out with a count of 8. Then I'll hold my breath for a count of 8. Breathe out first. Breathe in for a count of 4 in. Hold your breath for a count of 16. Breathe out with a count of 8 out. Hold your breath for a count of 8. Another set. Breathe in with a count of 4 in. Hold your breath with a count of 16. Breathe out with a count of 8 out. Hold your breath with a count of 8. You will have no idea how easily you will fall asleep. From there, now you sleep like a yogi. Yogis will first sleep on their right side. So let me go on the other side so you will see how do they sleep on the right side. They will go to the right side, and I'll be giving you a little explanation why they do it. They will go to the right side. Yogis generally don't have any pillows. They use the hands, use the hand as a pillow, and they bend their knees like a fetal position. Remember a fetal position, baby is sleeping inside the mother. Initially, our body core temperature is still high. Laying on the right side, it opens the left nostril. Left nostril breathing is cooling, and yoga practice is a balance. Like the higher core temperature, now getting balanced with a cool air coming in through your left nostril. This fetal position puts them to sleep right away. They keep an attention to their breath, breathing out longer than breathing in. And when they relax, the breath is so silent, you don't even know that they've been breathing. Once the deep sleep starts to come in, or sleep starts to come in, they will go ahead and start sleeping on your left side. They will turn. Generally, I turn on the one side in my bed, but just to show it to you, I'm turning my side so you will see how do they sleep. They will take their hands. Initially when you start doing it, you will see we'll have a little bit of a hand. You get call it thoracic outlet syndrome. You get a little numbness and you fall asleep. Just to put here. But if it is an issue, what you can do, you can put a little bit of a pillow. You can sleep in a pillow. Don't use too high a pillow. This pillow is good enough. Bend your knees like a fetal position, hands on both sides, maybe hands a little high up or in down, whatever is comfortable. Eyes closed. Breathing out longer than breathing in. Our main venous return, called inferior vena cava, is on the right side. So laying on the left side, you take out the pressure on the inferior vena cava, better return of the blood in your heart. With a proper relaxed breathing, you get a better preload. Heart preload goes high up. You are very relaxed. Afterload goes down. You get a better function of your heart. Cardiovascular system performs better. And this is the reason for your prenatal yoga or a natal yoga during pregnancy. You ask them to lay down on the left side so there is no compression of the inferior vena cava by the enlarged uterus. This also opens up in your right nostril. Always practice. When you say on side, you practice. You close your one nostril and you see which nostril is open. So, and if you see your right nostril is not more open, and when it's lay on your left side, within a short time, your right nostril will open up. Right nostril is heating. Now in the deep sleep, your body core temperature goes down, and right nostril breathing brings the balance in your body and mind. It's a wonderful practice, and if you sleep like this, starting from sleeping like a baby, called the laying close angle pose, called Supta Baddha Konasana, incorporating your breath holding, what is called your CO2 narcosis or carbon dioxide narcosis. Breath holding both in inhalation and exhalation. First laying on the right side to open your left nostril, then laying on your left side, opening right nostril. This is the way I sleep. Both of my nostrils are oleated with the oil, and I have an excellent sleep cycle. Wake up in the morning between 4 to 6 a.m., which is called Brahma Muhurta, time of the Supreme Being. When you get up, try not to get up suddenly. Slowly straighten up the right leg. Many people, I ask them to do a little yogic stretch in the bed, but if you're like me, us, we do it every morning. So get up, push your hand a little bit, with the hand pressure, you get up. When you get up, take a little time. Don't get down from your bed suddenly. You sit down a little bit with your feet on the ground, what is called the balance, shamatha, to bring the balance, because when you're laying down, all the muscles were relaxed, and when the muscles are relaxed, also the cardiovascular system needs to be adjusted. And then the sequence we start when you get up, that is called the Dinacharya, the daily routine. When you get up, you sit down in a squatting pose, drink a glass of water. We get up from sitting down. I go against a wall, put my body against the wall. This goes like a Tadasana, or called your Dandasana, like a stick pose, keeping your whole body relaxed. Then do your morning rituals, brush your teeth, tongue scraping, washing your nostril, neti part. Do your morning 1 hour of asana, pranayama, and meditation practice, late breakfast, main meal as a lunch, fruits and veggie as a separate snacks in the afternoon, early dinner, drink a glass of water, and oleation of your nostril before going to bed by 10 o'clock. Follow this daily routine, follow this yogic and asana, pranayama, in the way baby sleeps and yogi sleeps. Thank you. It's a wonderful practice. Please keep doing it. I have a lot of people who are asking me that they are interested to know what to do for insomnia and sleep apnea. Insomnia. In the United States, probably over 30% of the people have insomnia. In our Western medicine, sleep medicine is a separate subspecialty, a separate board. Largest number of medical laboratory facility today, most of the town, is called a sleep lab, sleep laboratory. Thank you again. We'll come back again next Saturday. Probably next Saturday is Easter, and I'm going to be out of town. Probably next weekend there will be no class, but I'll come back 2 weeks from now. Okay? Please make some comments, and if you have any questions, please ask me. I'll be glad to answer for you.